Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 240th episode, we have a great show with a great friend of the show, Howard Bird. Welcome back to the show, my friend.
Well, goodness, thank you so much for inviting me, Justin. I'm thrilled to have a chance to chat with you and your audience.
Yeah. So I don't know if my audience knows this. Certainly, maybe some of my newer listeners. I've been around now for a little over, I think we're going on 8 years, but you are the first reason I ever did a live broadcast from outside the studio. So you actually invited me to the HIMSS Venture Forum back in 2015 in Chicago. And I broadcast for 2 hours straight live on air, and I had never done that before, and I can't believe I pulled that off. I mean, that was just God's amazing. I just couldn't believe I had just, it's hard to talk for 2 hours straight. I had, I think, 12 guests roll through the show. Obviously, you, the winner of your Venture Forum, also came on air. So I want to thank you from the bottom of my heart, Howard, that you gave me that opportunity. You created the whole HIMSS radio. The reason I went to HIMSS every year and broadcast live from the main conference show floor was because you started it back in 2015 with a phenomenal idea and invitation. So thank you, my friend.
I'm sort of surprised you still invite me back after all that, for the trouble I've given you.
Yeah, right.
But no, I remember that that arrangement vividly. It was not just new for you and for me, but it was new for HIMSS, and it enabled HIMSS to take some steps it had not taken in terms of media that, frankly, probably cut into your audience. But I think it was great for all involved. Mm-hmm. Everybody benefited from the opportunity to meet with you and to speak to your audience.
Yeah, and I made some phenomenal relationships. You and I knew each other just sitting on boards before that, but even from that opportunity, some amazing relationships developed, even from that day. And then from the show, obviously from the show, fueled a lot of my world, my collaborations, my investment life. So, I owe a lot to you. So grateful. And it's always phenomenal to have you on here. You're the most prolific attorneys that we have in healthcare, digital health, and health IT. So I'm excited for today.
Well, thank you very much. It's very flattering. I wish it were accurate and understated, but I appreciate it. And I can also tell you that, We've talked about a number of the issues that we'll address today, but as you see, the feelings are quite mutual.
Yep. So since my audience has not heard your voice in a long time, several years, back up a little bit. Where'd you grow up, attend college, law school, all that good stuff?
Well, I grew up just outside of St. Louis, Missouri.
Okay.
For those of the people in your audience from St. Louis, I went to Pattonville and Ladue schools. You see, in St. Louis, something more important than what you do or how much you earn or the cut of your lawn or the cut of your hair is where you went to high school. Oh. So needed to get that in, just to have some credibility with the St. Louis folks.
Yep.
I went to college at Duke University, went to law school at the University of Virginia, where I created the first health law curriculum. There are some, in fact, the smarter law students naturally gravitate to the law and to thinking about the law as its own thing. I guess I represented those who were a step below in that I needed a field of endeavor to apply the law to understand both the law and that field of endeavor. And for me, I'd always been interested in health and health policy. Mm-hmm. So it was a natural to gravitate to what has now become health law. Then there was no such thing, or it was in its infancy.
Yep, very true. Talk about your so how do you specialize? I mean, is there a deeper specialty than just saying health law or digital health, or is there an area that you have kind of really dove into?
Well, in order to prevent my disbarment, in Pennsylvania, we're not allowed to specialize. Okay. We can focus, however. Mm-hmm. So I focus my practice on health law. And by that, I work with healthcare innovators to create new things. Now, that is awfully vague. Most of the time, I work with people who have ideas for new ways to provide care, new ways to enhance care, new ways to improve the healthcare process. And we create realities. That could be clinics, mm-hmm. that could be digital applications, that could be uses of information. So we start with the idea that I focus on healthcare innovation, and that can go any number of different directions. And I handle the health law aspects of it. I handle the corporate aspects of it. I handle the early capitalization issues that arise, the early HR issues, intellectual property, and so on. So that in a nutshell is what I do. People come to me with ideas and I help them create healthcare realities.
I love it. So on that note, what innovations or new directions are we seeing in health and health investing?
Well, I think the most important turn, and we've seen evolution as you and I have seen over the past 20 years, or even starting, I guess 20 years I've really been working very intensely in the health IT and health information world.
Yep.
We've seen the evolution from, how do you create and implement health record technologies, right? EHRs or payer-based records, to how do you use artificial intelligence? How do you link things? It turns out that just creating something new doesn't really necessarily make a difference anymore. And this goes back to what I do. Creating a really cool new thing isn't creating a business, isn't establishing a reality. And so a lot of what I see is people working, and this is a theme that will come back later in the conversation, Justin, on access. How do you create access for people? We sometimes take that for granted, or we sometimes define it only in terms of financial ability, right? The ability to pay. The ability to pay is not access.
Right.
The ability to get to care is access. The ability to reach out for help is access. And so what I'm seeing the investing go to are those applications that either dramatically improve the process of obtaining and using information for the benefit of the patient or the payer, very rarely for the benefit of the provider.
Right.
Because it's very hard to get the providers to say, I've got this great new source of information.
Yeah.
Because it's not already in their workflow, their method of operating, as it were. But if you give it to a payer, the payer can help push the innovation through. So that's one thing we're seeing. The other is, how do you get the care to the people? Whether it's telehealth, whether and I'll shamelessly mention innovations that some of my clients are doing without mentioning them, because I don't want to be too commercial on your show. But how do you improve the use of peripherals? How do you make that so easy that patients can go home and actually use the peripherals in a way that improves their health? That's a huge thing, because sending them home with a blood pressure monitor doesn't work. Sending them home with one thing they can plug into the wall and then do their blood ox, their blood pressure, take their step on the scale, etc., that can work. So you have to make the process consumable for consumers.
Right.
And so we're seeing a lot of innovation in that area. And we're also seeing, and I think this is really something to watch, is the disintermediation of certain kinds of practices. I have seen more innovation and more investment in innovation that will displace physical therapy that over the past 2 or 3 years. Mm-hmm. That to me, that's it may be obvious, but it's not just telehealth. It's how do you do volumetric scans so that a provider can watch what a patient does either remotely or asynchronistically and then respond to it. So those are the kinds of things I'm seeing. What are you seeing?
Well, actually, obviously that's a big question. But to your first point, though, I completely agree regarding what we have to do from an innovator standpoint and a creative standpoint, because I'm part of a Health Transformation Alliance, and recently this week we're talking about how there's so many people trying to create innovations to change physician workflows, but they're not approaching it from a way to make the physician's life and the care provider's life easier and to take off, to basically smooth that out for them, to optimize, it's not their workflows, it's more optimize their world in some ways, but you got to keep them front and center. And if you can make it easier for the patient, to your point, and you don't create new workflows or added problems or added clicks to the physician or the care providers, then that's a win that probably will get some traction, but also leverage their care teams. It's not more what the physician can do. It's how can we use these extenders that are out there, these care teams. Obviously, and that patient is a significant piece of that care team. So that's, to answer your question in a quick way, that's what I'm seeing. There's a lot of energy and excitement for that. But also, if you don't go along that path, you try to go, again, change what the physician's doing, you might get episodic wins from here and there, but you're not get large scale. You're not going to get big institutions. You're not going to change how healthcare is delivered, at least without a lot of money behind it, and also a lot of heartache. So I think that you've got to look for those areas of innovation that can make it better for the physician. And again, that's extending the care teams. That's including the patient, and it's not adding anything to the physician's daily workflow or plate, because that'll make it much more difficult and probably a failure. So that's a quick answer to your question. So, but
yeah, we're seeing many of the same things, and to bring it closer to home for something you've been involved with significantly over the past 5 or so years, we have focused from an equity perspective on social determinants of health. Mm-hmm. It turns out, if you really examine it, and I dealt with those issues before we used that acronym, working with the governor's office in Pennsylvania on the Medicaid program and on services to the elderly. We just didn't call it SDOH.
Right.
It turns out that if you really take a broader view, those issues apply to everybody regardless of socioeconomic status. It's just harder for people on the lower end of the socioeconomic stratum.
Right.
That's right. It's still important, and it's still important to address those issues, but let's not pretend they are unique. They're just worse.
Right. Very true. And for those that may have joined us a little late, my special guest today is longtime friend of the show and just good friend of myself, healthcare attorney Howard Bird. So, Howard, let's dive in a little bit to your latest venture, Gray Matters. Why do you think it's going to be a great success, and why are you so passionate about it?
Well, it flows out of something we just discussed, which is that I work with and look to work with great innovators. Mm-hmm. And if you examine the total market, the total number of instances of people in the United States, 45 and older, who are at some stage of cognitive decline or impairment today, okay, yep. There are about 32.9 million Americans, 10% of the population, have some form of cognitive decline or impairment. And what is done for them? So when 3 former clients approached me and said, we'd like you to get involved with this, we think that we need to create a clinic company, a clinical approach to serving these people. And I'll get into how we group those people. Mm-hmm. You know, I was immediately attracted to it because, let's face it, right now, if somebody has what we call subjective cognitive impairment, they're probably being ignored in a doctor's office, okay? Or mild cognitive impairment, they'll get some treatment. But what happens? Well, they'll go to the neurologist, they may get a prescription for Maricept, and they'll be told there's nothing that can be done. And that's just not an acceptable answer. Mm-hmm. So that was my early interest, is this is the biggest unaddressed field in medicine.
Wow.
The second reason is that the work of Dale Bredesen, who's a researcher who was with UCLA, or still is with UCLA, and the confirmation of that work by the Lancet Committee on Dementia, by Richard Isaacson at Weill Cornell, and so on, demonstrates that there are things that can be done, but not within the current approach, which is send somebody to a neurologist, give them a pill and hope to delay, because that simply hasn't worked and doesn't work. Right. And for the reasons that Dr. Bredesen and Dr. Isaacson and the folks in Great Britain on the Lancet addressed, which is the disease is multifactorial. Dr. Bredesen likens it to having a roof with 36 holes in it. Mm. So in order to help people with the disease, you need to address the underlying causes. The underlying cause is not the amyloid plaques that the Biogen drug says it can clear 20% of. By the way, at the risk of brain bleeds. So there is a downside.
Sure.
And it doesn't work all that often, and it costs a tremendous amount. But the fact is, that's already too late. That's waiting until the problem exists. So one reason I was interested was the total number of people who are suffering, who have no place to go, and who are frustrated by that, and their families are frustrated by it. The second is there's something that can be done in a clinical sense by treating people with cognitive issues or at risk for cognitive issues the same way we treat every other chronic disease, right? If you go to a cardiologist, you find out why. Not just that you have a cardiac problem, but what's causing it.
Right. So what's the most significant clinical or patient care success that you've seen since you guys have launched the business?
Well, we only launched the business 8 months ago. So, or only opened the first clinic 8 months ago. We had about a year of planning prior to that. So what we've seen so far is that we have healthier patients whose conditions have improved. Now, over time, and not just their brain condition, okay, but their overall health has improved. And by the way, if your overall health improves, your brain health improves too.
For sure.
So what we do at Gray Matters is we provide the patients and their families and caregivers with whole health, whole person guidance and support, because these people felt abandoned, or worse, when they end up in a memory center warehouse. And I know of nobody, and I could be wrong here, and somebody in your audience may text you that I'm completely wrong. I know of nobody who thinks, gee, if I could only be in a memory center.
Right.
Especially after COVID, when those are the places that were hardest hit.
Yes.
So our goal is to help people remain independent and to work with them. And they come to us knowing that we're with them. We're there to help them retain their independence to the extent possible. Now, the data will tell you that it doesn't work 100% of the time. By the way, nothing does.
Nothing does, yeah.
In any endeavor of healthcare. But in Dr. Bredesen's latest studies, he had 84% success.
Yes.
We'll take that. Do I think that's replicable? It doesn't have to be.
Right.
So the families know that we are there, that they can call us. And I'll give you an example, again, without mentioning a name. One of the most prominent investors, practically the inventor of venture capital, and he has his own new venture fund focusing on the elderly, for those of you who want to look it up. His wife had Alzheimer's for 12 years and ultimately died of it. Nobody, this is one of the richest men in the country, nobody could step up. No provider stepped up and said, we will guide your care.
Right. Wow.
And it's not because he couldn't afford it or couldn't reach out to people. It's that nobody had the wherewithal to do that. At Gray Matters, we do that.
Wow.
So,
what are your goals in the closing couple minutes that I have? What are your goals for Gray Matters over the next 12, 24 months or so? What do you hope to achieve?
Well, we've got sort of overall goals and specific goals. The overall goal is we want to make brain health and brain health assessment as ubiquitous as cardiac checkups and colonoscopies.
Yeah.
Okay. If you're 40 or older, you should do a CQ test. You should have the blood tests so that if there's an underlying issue, whether it be infection or trauma or vascular issues or prediabetes or diabetes, any of the contributing or environmental factors, and those turn out to be really big in Florida with mold and so on, can we address those issues? And we can address those issues, but you can't address them if you don't know about them. So even if everybody doesn't do it, if the people who have family history get in and get tested, that'd be great. If people who have subjective cognitive impairment means nobody else may notice, but you know that you're missing something. We can get them and we can help. So that's our sort of our overall goal, so that we can help people as early as possible and make this a part of the healthcare journey for everybody. Okay. And so if we do that, our goal for the next 12 months is to get as many people as possible to get tested, because many of them, we can say, here are a couple of things you can do, come back in a year.
Okay.
For some, it's going to be, gee, we can see you're having a couple of issues. Let's find out why. Let's address those underlying causes. And so over the next 12 months, we think that'll happen. We're open in Jacksonville. We're open in Sarasota. We're talking to assisted living facilities across the country who want to make what we do part of their larger offering. Because for an assisted living facility, keeping the people there and independent is vastly superior to watching them leave to go to a memory center.
Wow.
So from a business perspective, it makes sense. And for the individuals, it makes sense.
So you have facilities, locations in Florida, and how are you expanding, and how would someone in California or Arizona or Washington State or Michigan, how would they engage Gray Matters or you if they want help with something?
Well, our doctors are being licensed wherever we have patients, or we make contact with the primary care providers or other providers for those patients in those states, because we want to make certain that our services fall within the telemedicine laws and the licensure laws in those states. But as we grow, we're finding that we have lots of contacts and there are lots of physician networks that are very happy to engage with us. So that's not an issue. The first thing we'll do is order the tests. Let's get the blood work done. Let's have the person take the 15 to 20 minute CQ test, and get an assessment. Where are these folks? You know, how can we address what's going on? And by the way, it's hard to do, especially for an older person. There are often family members involved, and sometimes they're in favor, sometimes they're not. It requires us, and this is part of what we offer, to listen. It's an awfully strange thing, I guess. Not strange, but perhaps we learned this in kindergarten, Justin.
Well, actually, I'm going to leave it at that because actually we're at time, so I got to close the show. But no, this has been phenomenal. I love it, Howard. Congratulations, and thank you for joining me on air today and taking time out of your busy schedule to join us. And also, thank you to everyone for joining us today. Please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadios and respond to your comments from the show. If you missed any of the episode or want to hear more, all my shows are posted at Apple iTunes, SoundCloud, iHeartRadio, and TuneIn. Also, you can check out some of the updates we put on justinbarnes.com. Thanks, everyone. Stay safe. And thanks again, Howard.